Further debate. I recognize the member from Guelph.
Rise today to speak on Bill 175, and I realize this bill was introduced before the COVID pandemic, but after the tragedy we have witnessed in long-term care homes, I don't understand how the government could move forward with a bill that risks increasing privatization in new congregate care settings. Why would the government launch a new care model without enshrining care standards and legal parameters in the legislation itself? If this bill is really about improving care for people, why is the government removing the Patient Bill of Rights from legislation, reducing accountability and the protection of people's rights in our home and community care settings? Over and over again, Speaker, Bill 75 is asking MPPs to vote on a bill that fails to enshrine quality public care and patient rights in legislation. On top of all of that, the language in the bill suggests that home and community care service providers will be permitted to develop their own process for reviewing complaints. As one of my constituents from Guelph, a former home care manager, told the committee, this is like having the fox taking care of the hens in the hen house. Or to quote the Ontario Nurses Association, and I quote, self-monitoring by for-profit service providers as a recipe for the erosion of quality client care, end quote. Speaker, it's possible. I believe it's possible to have people-centered care, integrated decision-making, fewer silos, along with new forms of congregate care, without, and the key is without, opening the door to more privatization, reducing oversight and patient rights, and consolidating power in the hands of the minister, which is what Bill 175 does. Speaker, I want to close by saying that if the government is serious about improving home and community care, then it would listen to the Registered Nurses Association of Ontario, who put forward compelling evidence that the sector needs a 20% increase in funding. If we've learned anything from the COVID pandemic, we need higher wages for personal support workers and full-time employment to bring stability to home and community care. We need to hire more RNs, and we know the return on investment of doing so would be significant. Sadly, Bill 175 fails to deliver the better care Ontarians need and deserve.
Questions? Question? Okay, the member from Nickel Belt.
Thank you. I'd like to thank the member for his brief remark. You attended part of the deputations on the bill. From what you've heard and from what you've read, is there anything in the bill that preclude community services from being subcontracted out to the for-profit?
Response, the member from Guelph.
I appreciate the member's question. And from what I've read in the bill and from what I've heard at committee, there's nothing that prevents additional privatization in home and community care. As a matter of fact, there were many people who came to committee and many people who've come to the lawn at Queen's Park who were specifically raised concerns about privatization in the new congregate care settings, particularly after the tragedies we've seen in long-term care. I'm worried the government hasn't learned from that and they haven't applied the lessons of COVID to Bill 175.
Question, the member from Eglinton Lawrence.
Thank you very much, Speaker. You know, it's interesting. There's some obsession about patient rights and why we took the Bill of Rights out of the existing legislation. Well, the reason was because we were in this legislation going to repeal. We were going to repeal that legislation. So if we didn't take the Bill of Rights and put it in the regulation, it would no longer exist. So we kept it in the regulation, thinking people would like that. But maybe we shouldn't have done that. I don't know. There's nothing in this bill that takes away patient rights. It's all there. You still have the appeal to the from the health service provider. You still have the HSARB appeal, the Health Service and Appeal Review Board. You still have the patient ombudsman, and you still have the Bill of Rights, and a regulation has the force of law. So what the heck is the matter with that? I ask my honourable friend.
Response, the member from Guelph.
I appreciate the member's question. It would be, I think, more responsible for MPPs to actually know what they're voting on. And the bottom line is when you move it out, the patient Bill of Rights, out of legislation and into regulation, you consolidate the power of making those decisions in the hands of the minister. We would be so much, the people of Ontario, and I believe all MPPs, would have so much more confidence if the Bill of Rights were in the legislation itself, so people knew what their rights were and knew they couldn't be changed by an order in council. And so that seems to be a typical move. I can't tell you how many committees I'm on where the government seems to be transferring power out of legislation, which is what MPPs can publicly debate, into regulations, which is really done through an order in council.
Question, member from Nickel Belt.
Thank you. I want to, of your knowledge of the bill, do you see anything in the bill that would help PSW job become career? As in, do you see a strategy within the bill that would allow PSW to have full-time work, to have a living wage, to have sick days, to have access to benefits, to have access to a pension plan, to have a career in home care? Do you see any strategy within the bill that would bring us toward that goal?
Response, the member from Guelph.
Hey, the member's question. I don't see such a strategy, and it's actually one of the flaws in the government's approach to home and community care. I can't tell you how many personal support workers I've heard from who can barely make it from home to home to home because they are on such a tight schedule. And because they're on such a tight schedule, they aren't able to really provide the care they want to provide because they don't have the time to do it. And so we absolutely need a strategy that pays personal support workers a living wage, that guarantees them full-time employment, and ensures that their day is scheduled in a way that they can provide the kind of care for people that PSWs want to provide and that people and patients deserve.
Question? Member from Eglinton Lawrence.
Thank you, Speaker. Interesting comments there. Just to go back to the Bill of Rights for a second, the regulations were posted. The summaries of the regulations were posted. I don't know if you had a chance to consult with your constituents about what was in the regulations, but it included the Bill of Rights as it was, with the suggestion that perhaps it should be updated and modernized to include some equity considerations that are more prevalent now than they were in 1994 when the legislation was drafted. So certainly we're looking for input on those things, and as we said in our submissions, the Minister and I, still consulting. So on the personal support worker issue, I think that the legislation will enable us to be able to help personal support workers with the thing that keeps coming up all the time, scheduling. Scheduling. Those poor personal support workers get 1 hour here and 1 hour at the opposite end of the city, and it doesn't matter how much you pay them for 2 hours, they need a full day. So that is the problem. Yeah. So that has to be fixed. It doesn't matter how much you pay them for 1 hour or 2 hours, they need 8 hours.
Thank you. Response, the member from Guelph.
I appreciate the member's question. And if the legislation provided minimum standards of care, legislated minimum standards of care, legislated protections for personal support workers, then I think we'd be in agreement. The challenge with this bill is that none of that's in the bill. So this seems to be a strategy that I see over and over by this government, is they remove things from legislation that's democratically debated in the House among MPPs and move it into regulation, which of course they do post regulations for public comment. But at the end of the day, that's decided by an order in council, not by a vote of MPPs in a democratic legislature.
Question? The member from Nickel Belt.
Thank you, Speaker. I agree with what the member just said. Back in 2007, when we did changes to the Long-Term Care Home Act, the NDP wanted really bad to have a minimum standards of hands-on care. We used to have one. It was 2.25. The government said, no, we're not going to put it in legislation because it could change. The needs increase. We'll put it in regulation. That was in 2007. Fast forward to 2020, we still do not have a minimum standards of hands-on cares. No regulation was ever done, but many, many promises were made in that House that we don't need it in legislations, we will put it in regulation. So along that line, do you see any problem with for-profit company, ParaMed, Bayshore, you name it, being allowed to assess the needs of a client as well as coordinate the care and deliver the service?
Response, the member from Guelph.
Appreciate the member's question. I definitely have concerns with that because there is no legislated minimum standard of care. I would have less concerns if there was a legislated minimum standard of care, and we just have to look at long-term care for an example of that. I believe there's a member on your benches who've put forward a bill asking for a minimum standard of care in long-term care. I would support that. I think we should have a legislated minimum standard of care in long-term care. I believe if we'd had a legislated minimum standard of care in long-term care, we wouldn't have seen the tragic consequences of the COVID pandemic in our long-term care facilities. So why don't we put a minimum standard of care for home and community care so we can avoid this in the future?
Question, the member from Eglinton Lawrence.
Thank you, Speaker. And I want to ask the member opposite if he realizes that this approach to home care, having part regulation and part legislation, as we have in our legislation, is allowing us to update, also publicly posting, as I mentioned, those regulations and keep the legislation updated. We had those draft regulations posted. Again, I don't know if he consulted with his constituents about them, but they were posted for 60 days and fully available for everyone to comment on. We're still accepting comments. And they do it this way in Alberta and British Columbia, and it seems to work for their home care legislation. I'm afraid if we put funding in legislation, for example, or a health human resource strategy, we wouldn't be able to update it for our needs. And what we really want to do is respond to patient needs, no?
Response, the member from Guelph. Order.
Thank you, Speaker. Thank you for the question. Actually, we don't need all the details you're talking about. What we need is a legislated minimum standard of care. If we had a legislated minimum standard of care, then the details of how to achieve that legislative minimum standard of care could be implemented. That's what would improve this legislation. I've said over and over again that we can have more integrated care and improve home care, but we can do it without creeping privatization. We can do it without removing patient bill of rights, and I believe I'm out of time.
Thank you. I believe you are.